Kwanza nataka kuelewa because statistics of HIV and AIDS among adolescents and young people, tunaangalia 10 to 19 and particularly 15 to 24, is very high in this country. So why is it so? Tell us that. And then tell us how, because we are within that age bracket. Na tukienda sana labda baka 30, si ndio? Na it is still high among that population. So why is it so? And what can young people do to help in reducing the rate of HIV amongst young people? So tuambie hayo as king of condoms.
Thank you, Mercy. I want to be shy by saying that young people are sexually active. As you are talking here, somebody is busy somewhere doing it. Another person is planning to do it today or tomorrow. And when I told my friends that I'm coming here, I knocked Kiss Condom Company. They gave me a lot of condoms to share with you people. Tuwapigie makofi. So, I want to talk as a king of condom, also as a parent, because my son was here doing computers and some other things. And as a parent, we are scared. Anytime we get a strange call, we pick, because we don't know whether it's from your son or somebody is telling you about your son or your daughter. We are scared because of things that are happening around. It's so scaring that 62% of all new HIV infections in 2026, out of 100 people, and I want you to listen, out of 100 people who turn positive today in Kenya, 62 is between 15 and 30 years. People that are seated here. Why? Sex was created by God. Thank you, God. And it had only two purposes. One, procreation and pleasure. Tuko pamoja. Now, how can a 15-year-old person acquire HIV through pleasure? Another thing that I want to emphasize is teeny pregnancy. It's so sad that last year we had, and I want you to count, 240,000 girls between age of 15 to 18 and below 18 got pregnant. Who are responsible? Anybody seated here who knows a young person below 18, maybe back at home, who is pregnant or was pregnant or have a baby? So you know them. What transpired? Who is responsible? Why? So we are here to discuss on responsibility. We are here to understand our body. There is a lot of myth and misconception about sex. That when you have sex when standing, you cannot get pregnant. The cycle, you are safe, you are not safe. Withdrawal, withdrawal should only be done in M-Pesa and bank. We need to understand how old is HIV, and I'll give you a present. How old is HIV in our country? 80. You are wrong. How old is HIV? Yes, sir. How old is HIV? 60. 16 plus 26. Add. How did you know that? Come for a condom. Come. Thank you very much. Come for a Kiss condom. Black Kiss condom. How did you know that? 16 plus 24. What happened? So, yes. Thank you very much. And I'll give you more for this month. Tell me you're surprised. Thank you very much. HIV is 42 years old. Half of the most of you. How old are you, young man? The one who have answered, how old are you? How old is HIV? So what am I saying? A lot of people don't know the journey of HIV. The first people were buried with nylon papers. We didn't have ARVs. We didn't have test kits. People were tested in Kenyatta Hospital. You wait for your results after 3 months, and they are being sent through post office. There was no counseling. There was no ARV. People suffered, and people died, and they were buried the way COVID people are buried. 2000, the first ARVs started coming. HIV testing started coming, and people are living quality life. But the challenge is myths and conceptions about sex. Let's talk about sex. Ebu, look at me, everybody. If you have ever had sex, can you close one of your eyes like this? Thank you. Thank you very much. At least I'm talking to the right people. Who taught you about sex? Very good. God created sex and said, will be taught. How many people have ever seen hens, cuckoo, having sex? Have you ever seen? Dogs, cows, goats, human beings? No, apart from yourself. Now, we are doing a lot of pornography, you know. We have a lot of fetish. And maybe because of time, mercy, we would like to have more time. It's so sad that young people are putting cocaine on condom, then they insert it in women. Women get addicted in that cocaine and feel that they are attracted to somebody. They want sex every day, and they become slaves of sex. A lot of people are selling sex in exchange of exams, favor, jobs, and everything. We have overrated sex. And we have overrated sex without condom. One thing I want to emphasize is
young people tunashanga kwani tunaongea juu ya cancer, and why now? So maybe you can tell us more.
Free from intended pregnancy, free from STIs, free from HIV, sex that is consented. You have given somebody permission. You have agreed that person is on the right age, over 18 years. Even 2 days before 18 is a child. You'll go to jail. Sex that both of you understand what you're doing. And that's what you are advocating for. Safer sex. And also, your priority today is your priority to be a father, a mother, or to graduate. What is your priority? Anytime that you're engaging to sex, it's like a rehearsal you're doing to be a father or a mother. Because sex have 3 results. Number 1, you'll enjoy. You'll feel good. Hey, I had sex. And big sexual organ in our brain, in our mind. Number 2, after sex, somebody might get STI. Somebody might get HIV. Somebody might get pregnancy. Maybe you'll get what you want. We must talk about sex and understand sex. Number 3, we have free youth-friendly services. For instance, we have AHF. AHF is an NGO. They are treating all young people, STI screening, even cervical cancer. They are treating for free. The offices, one is in Madare, the other one is in Pakrant, the other one is in Kagundo Road. And you can call and you can get them. Can you do screening? Can you do screening of STIs? We have STIs that maybe we do a lot of over-the-counter treatment, daktari. And you take the wrong medication for the STI that you have, and then the STI is still in your body. Rastri is about the types of sex we have. We have 3 types of sex. One. You are starting with oral, as if God started sex with oral. Oral, anal, and heterosexual. A lot of people don't know what they are looking into sex. And you people are in that age of experiment. Can you have safer experiment if you have to do it? Can you learn? And we have what we call 3 years. Look, listen, and learn what you're engaging yourself into. Are we together? The youth-friendly services are there. Lastly is about cancer. Thank you very much, Dr. Through oral sex, people are getting throat cancer. If somebody have HPV, the virus that bring cervical cancer, and is in the throat, and then you go enjoy yourself, you finally get, are they many? There are many? To both men and women? Yes. So we need to be responsible. We need to be aware. We need to create awareness. We need to understand our body. We need to understand that sex is not only for reproduction. We need also to know what is happening. Mercy, let me talk about the death and the mental health. Every day, something is trending. KMTC girl killed. This university killed. This university. Let me tell you, stop bride dates. Stop going out with strangers. Stop being driven by money and excitement. Sex has 4 stages. Number 1, excitement. You must be excitement. You must be excited for you to engage into sex. Number 2, you must be aroused. Stop being aroused by money. A lot of people are aroused by money. They're excited by money. You can't even get to the climax through money because sex is physical. We need to talk about sex. We need to understand about our body. We need to be focused, and we need to have our goals. Mercy, I can talk. And finally is about condom. Never use 2 condoms at a time. These guys, because of security, they are putting on 2 condoms. Or 3. Depending with the nature of the situation and the person they are in. It is illegal. It is unconstitutional. Number 3. Condoms should be used from the start to the end. A lot of young people are starting without condom. When they want to ejaculate, they put on condom. That is illegal. It is unconstitutional. Disposal of condom. And this is where, young men, I want to help you. Once you finish your sex activities with a condom, carry your condom, put it safe. 3B, burn, put in a bin, all, bury. Take responsibility of your condom because it have your DNA. I'm saying this because I have seen some men in jail, somebody picking the condom, pasting on a baby, then you are accused that you raped a child. Then when the DNA is done, it is evidence, it is there. How did your DNA get into a baby? And then you go to jail. You must be responsible after every activity. Are we together? Multiple partners. And this is where university guys, you are going wrong. And I have to tell you, as a parent, as the king of condom in Africa, you have a girlfriend here in first year. Then you have another one in the village. Then you have Mama Boga. Then you are targeting somebody. The caretaker in where you are living. Then you have multiple partners as a man. Then the young girls. University. We have to talk the truth. Uko na mpoa, uko na muinches, uko na mu-verified, uko na sponsor. Can we stop this madness of multiple partners? Because that's where we are going to get all these HPV. We get the throat cancer. And it will be very sad. You have HIV, you have throat cancer, you have maybe colon cancer. You have mental disorder because of all those things. Now you become a very, 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 maybe a person who cannot be helped because you have a lot of things. But together we can make a difference. We are ready to listen to you, to give you information. We have gone through there. We have experience. And together we can make a difference. Thank you, Mercy.
Thank you so much, and thank you, panel. And one thing is clear. for us to prevent HIV, to reduce the rate of HIV, we need to apply, we call it the ABCs. First and foremost, sex is not only physical, it is spiritual, it is emotional, it is social, it is physical, as you have said. So if you cannot abstain, abstinence. If you cannot abstain, be faithful to that person. And if you cannot, then that's where we talk about correct and consistent use of condom. So this is a conversation we cannot be able to exhaust within one setup. Sawa sawa. But before we close the panel, I would want to invite any question. Any question, address it to any of us. You've heard about wellness, and wellness is broad, right? There's physical wellness, there's mental wellness, right? And there's also mental illness. You've heard about some of the challenges that we face as a university student, right? Beyond academic performance, relationship is one of it, right? So anyone with any question, and please feel free to address it to any of us, because I know Isaac needs to leave for other duties. But if you have any questions, Isaac, now is the time, right? As well as Dr. Moki. So feel free to just address the question to anyone in the panel.
Okay.
Yes.
Can you hear me? Oh, I'm actually asking this question for a friend, so it's not me in the bracket.
For a friend, eh?
Yeah, for a friend. Okay, so for example, let's say you've entangled yourself with a person, you've gotten intimate, and then you realize they maybe have the virus of HIV. Like, can you like explain the stages of the precaution you should take so that you avoid any altercation in the future?
Wow, that's a very good question. Thank you very much for a Fred. And Fred, you have a good Fred who is asking a question for a Fred. So you'll also give you condom for that Fred, to take the Fred condom. Now listen, HIV takes 72 hours from, if I have HIV, I expose myself to somebody, maybe who is HIV negative, it will take 72 hours to get into the white blood cells. Sawa. And within that, we have something that can do intervention. We call it PEP. We call it? We call it? That is a medication you will take within 72 hours when they are not over. Sindio? And you take for 28 days. It is called PEP. So you are safe. Rule number 1, never engage into sex activity with somebody that you don't know his or her status, and maybe you don't know where to get PrEP. Sawa? That one good. Number 2, yes, I have a sample. Thank you very much. Then we have PrEP. The first one was PEP. Then we have PrEP. If you have sex, and this one, university, take this one. You're going for holiday 3 months. A girlfriend will be away for 3 months. In the village, uko Kericho, nawe uko Mwea. You can understand the distance. Your girlfriend will connect with the inches back at home. And you with your power at home. Make sure that you are safe. When you are going for a long holiday, take this PrEP with you. You take it as long as you have multiple partners. You cannot get HIV. And you have now advanced this to injectable. You can be injected after every 2 months or after every 6 months, and you cannot get HIV. And the last one is ARV. If you get HIV positive, you take ARV every day. And if you are taking ARV every day, you cannot be able to infect anybody when you reach into a stage we call U equals U. If your virus cannot be detected, you cannot infect anybody. And that doesn't mean that you don't have the virus in your body. You have the virus in the body, but we check the amount of virus in your body is so little. Because the difference between HIV and AIDS is one. When you have AIDS, you have millions and millions of HIV. I want you to compare a bag of sugar and a teaspoon of sugar. Tuko pamoja? So when you are HIV, you have a teaspoon of sugar. When you have AIDS, you have a bag of. So the virus is like that bag. So a lot of people are HIV positive because they have literal viruses in their body. They are able to control them using ARV.
Cancer is a big term. Kwanza tuanzie hapo Na kwanza young people tunashangaa kwani tunaongea juu ya cancer and why now? So maybe you can tell us more about what is it? It's very diverse. But then how does it affect us as young people? Yeah.
Thank you, Mercy. My name is Momo. Based at Texas Cancer Center. Texas Cancer Center. Thank you. I'm here on behalf of the Texas Cancer Center family to create awareness of what cancer is. Cancer may sound a very scary terminology, but basically what is cancer? Cancer is just your normal cells changing from normal cells to cancerous cells. They change from being normal to something abnormal. Sawa. For today we are here to do cancer screening. We'll only measure about 3 cancers. One is breast cancer. And when I say breast cancer, it's both for men and for ladies. Nowadays, men also get breast cancer. We'll also do cervical cancer screening. That's specifically for ladies. And for the men also, we'll do prostate cancer screening. Prostate cancer is simply for the men. So in terms of cancer, why are we doing this? Why are we doing all this? You'll understand that currently, majority of the patients that we see in the hospitals, they usually present with an advanced state of cancer. Apparently, like 70% of the patients that we see in the hospitals, they usually present with a stage 3 or stage 4 disease. Now, in stage 3 and stage 4 disease, okay, most of them in stage 4 disease, we usually have very limited treatment options. The outcomes are not good. We lose most of our patients due to late diagnosis. And the government is doing on its part, and we as young people or the medical personnel, we have a duty to educate the society about what is cancer, what is screening, and to remind you that cancer is treatable. Cancer, once diagnosed at early stage, it's treatable and curable. So we can't continue losing our patients. I've lost so many friends. I've lost relatives. Some of my friends, the chats are still here in my phone. Sometimes I try to look at the chats and I imagine, what if this person angeambiwa mapema what cancer screening is? Maybe huyu mtu angedetectiwa mapema, and maybe angetibiwa mapema, and maybe today they could be alive. So you'll realize that most of the people with cancer are not the ones that have been treated. but the ones that are walking around. The ones that are walking around with either active cancer or precancerous cells within their bodies ndio wengi kuliko hata wenye wako kwa treatment saa hizi. So we need to put more effort to ensure that at least we beat this monster. When HIV and AIDS came about in Kenya, there was a lot of stigma and a lot of energy was put, and HIV ilipigwa ikapigwa. Nowadays people don't talk much about HIV, or people don't fear HIV. Actually ile ugonjwa ukiuliza kila mtu hata kwa barabara, ile ugonjwa yenye wanaogopa sana ni gani? Ni cancer, si ndio? Doesn't mean that cancer is not cannot be addressed. The only issue is that in Kenya, bear in mind that we are a third world country. Our screening programs are very, very poor. So most of the patients, by the time they are diagnosed, unapatanga ugonjwa imeenda. Kama mtu ugonjwa ilikuwa kwa matiti, instead angejulikana mapema atibiwe, unapata imeenda kwa brain, ugonjwa imeenda kwa lungs, ugonjwa imeenda kwa liver, ugonjwa imeenda kwa bones. You find that most of the patients that when they arrive to the hospital, we have very limited treatment options for them, and most of the time they usually do what we call palliative care. So we want to try and educate more people about what is cancer, and as young people, we have a role to play when it comes to cancer awareness. We have a role to play when it comes to cancer awareness. I don't know what is the nature of our I don't know, it's an African nature, but most of our parents at home wananyamazianga vitu mingi. So by the time you realize your mother, your father, your grandfather has an issue, unapata imechelewa sana. So we have a role to be good ambassadors to our families and also society at large. In case you have a family member and you notice something different and something unusual from them, kindly it's good to take them to the hospital for them to get screened. What is this something unusual? Of course, not all cancers can be screened, but if for you or maybe your parent, maybe you notice something abnormal in your breast, for ladies and also for men, it's good to go to the hospital and get checked. For those people who have been treated ulcers, it's called ulcers or H. pylori. H. pylori. That thing is messing a lot of people, and most of the people end up being diagnosed with esophageal cancer, cancer of the esophagus, or maybe cancer of the stomach, that is gastric cancer. So in case you notice something abnormal in your body, kindly go to the hospital and get screened. Kindly talk to your parents, kindly talk to your relatives, kindly be good ambassadors even to the society, that we need to work together to make sure that we create a lot of awareness and we fight this monster called cancer. It can't continue killing our people when it can be diagnosed early and get treated. Cancer is treatable once diagnosed.
Okay. Is cancer generic?
Generic. I understand your question. Thank you. So, we usually say, what is cancer? We said cancer is just a change of the normal cells from normal cells to cancerous cells. Now, cancer usually a combination of genetic factors and environmental factors. But environmental factors, they usually amount to around 90%. The genetic part is around 10%. So there are some cancers that have a genetic lineage. One of them is breast cancer. If you notice that, thank you. There are some cancers that have a genetic lineage. One of them is breast cancer. If you notice that your grandmother, your mother, or maybe your sibling, they have breast cancer, it's good as a lady to really go for breast cancer screening. Another one that has a genetic lineage is cancers within the colon and also the rectum. If you notice that anyone from your lineage or from your relatives, they have a history of cancer, it's good for both men and women, you go and get screened. Another cancer that has some genetic lineage, I've talked about breast, I've talked about colon and also rectal cancer. It's also prostate cancer. If you notice that there is someone in your lineage, maybe your father, your grandfather, or maybe your uncle, someone close to you, your brother, and you're a man, and they had prostate cancer, anytime once you get 40 to 45 years of age, you need to begin getting screened more frequently, because those are some of the cancers that have a genetic lineage. Thank you.
Please, I would like people to get number of Dr. Momo, because very knowledgeable. Give us your number, please.
Thank you. My official number is 0743 500 384. You can call me anytime. 0743 500 384. I usually get a lot of calls from all over the country. So in case you have someone somewhere at home, you are suspecting, or maybe they have cancer, they have not been treated, kindly give me a call. We organize for them. They start treatment as soon as possible. Sawa sawa. Thank you.
So, even as we get the next question, so King of Condom has talked about PrEP. PrEP in full is pre-exposure prophylaxis. PEP is post-exposure prophylaxis. Sawa sawa? Yeah.
Hi everybody. I have a question to the doctor again, and this is because we have seen, many people have seen, and we have seen victims of cancer in the country and all over. You can hear me? Hi everybody. So my name is Jeff. I'm here to learn more about what is happening today. And first of all is to appreciate all of you. So my question is, why is it that we see many people going outside the country to be treated in India and in other countries? So is it that we don't have good facilities in Kenya, or what normally happens? Or is it that we don't have the best doctors, the best equipment? Can you kindly maybe address that?
Yes.
Thank you.
Thank you. Let me answer instantly. One of the reasons as to why I'm here is to create awareness that cancer is treatable in Kenya. The only thing is that sijui kwa nini watu wengine hawaminingi what we do in Kenya, but whatever we are doing in Kenya is what apparently is being done in India. I have a patient like 3 or 4. One was treated in the United States of America. One was treated in Canada. 3 been treated in India, and then there is one that was treated in Germany. And whatever they are giving there is what we are giving here. So whatever we are doing here in Kenya in terms of the chemotherapies, in terms of the immunotherapies, in terms of the radiotherapy, brachytherapy, is not different from whatever they are getting from India. So in Kenya, we have capability of treating all manners of cancers, not unless it's something complex like bone marrow transplants that maybe may need someone to go to India. Maybe those very, very complex like bone marrow transplant. But in terms of cancer treatment, the chemotherapies, the drugs that we get here, I have seen like last week, there is a patient from Wajir. She came with a prescription from India. The drugs that were prescribed are the same drugs that we have in the pharmacy. So there is no difference. Thank you.
Thank you. So my question to Doc, I want to ask, what advances in cancer treatment or prevention that that give you most hope in the future?
Sorry, come up again.
What advances in prevention of cancer or diagnosis that give you most hope in the future?
Advances.
Yeah.
It's a good question. I told you that I've lost so many patients. And at the same time, I've seen so many patients that we have declared them cancer-free. Like today in the morning, I told you yesterday I lost a patient, a friend of mine. But today in the morning, there is a Shosh with cervical cancer. We've done treatment. And today, once she brought the post-treatment scans, she was cancer-free. She's from Migori. So, yeah, she's from Migori. You can imagine she has traveled all the way from Migori to get treatment in Nairobi. And after that treatment, we can now declare her cancer-free. Cancer is treatable once diagnosed early, and that's why we are here on the field to really encourage people to get screened early, because the number of deaths that we are facing as a country, and mostly in Africa, they are quite alarming. So, and also new research and new treatment options are coming each and every time. We usually change cancer treatment plans every now and then because new researches are being done on how we can treat these cancers better. It's not like kitambo wakati we had very limited treatment options. Nowadays, kuna a lot of research and very innovative treatment methods of treating cancer. Some might be somehow expensive, but the outcomes, they're usually good. Like there is a lady friend of mine, she has been treated for renal cell carcinoma, that is kidney. She had one kidney removed. She's surviving with one kidney. She has spent a lot, close to 20 million, but after all that, we declared her cancer-free. So